Quote, "Working hard won't help unless you work on right things." Unquote. This is the motto and the mantra of the president of Raheja Consulting Incorporated, located in Laurel, Maryland. Interestingly enough, the president of this well-known consulting firm is Mr. Dave Raheja. Recently, Mr. Raheja paid a visit to our studio, and let me share what he had to say on camera.
My name is Dave Raheja. I am the author of the book Safer Hospital Care, and also I'm a patient safety consultant. Hospitals have a lot of mistakes happening every day. In fact, the National Patient Safety Foundation said 400,000 mistakes happen a year. These mistakes all kill the patients. They are not just ordinary mistakes. And so I'm going to give you a lot of examples of these mistakes today. And so the question is why the mistakes start. Well, the reason for that is at one time the doctor was in charge of the patient. It's no longer true today. Today the patient care is divided into many caregivers, many interactions, many medications, many logistic systems, and a lot of miscommunications and communications. That's how mistakes keep happening. So let's look at the examples of mistakes. Number one on my list is diagnostics mistakes. And I'm sure you have some friends or relatives who have been through that experience. And these mistakes happen in large numbers. According to the doctor in New York School of Medicine, about 10% patients get wrong diagnosis. A university hospital in Baltimore did the research on autopsies. They found at least 5% died from wrong diagnosis. So there is a big area of improvement there. Actually, one of my friends, he took his mother, 70-year-old mother, to a best orthopedic surgeon because she had a foot problem. She couldn't tolerate pain at all. And she wanted the best surgeon, and she got one. This surgeon took MRI, told her, "You need surgery right away, and your foot is infected badly." And she had tried to ask questions, but since he was the best doctor in the town, everyone wanted to go to him, so he's so busy, he doesn't have time to answer her questions. And she was disgusted, he's not answering her questions, and she left the hospital without taking any appointment, and she went to another hospital. And the doctor at the other hospital took the MRI and a couple other tests, and he told her, "You don't have anything wrong with you. All you need is an antibiotic. You don't need any surgery." She was so happy. So this is a good example of diagnostic mistake. The next area I want to touch is surgical mistakes. I'm sure you have heard a lot of horror stories in that area also, like working on the wrong surgery on the wrong patient, surgery on the wrong foot or wrong leg or wrong eye, and then people leaving a lot of sponges in the bodies of the patients. And then you must have heard about the airport security. People find metal knives and metal forks in the bodies of the travelers. And this is how serious the surgical mistakes are. So this is so some hospitals are trying to do a good job on it. The World Health Organization has created a new checklist which forces the whole entire team to take a time out to stand up, stop everything, question everything. If any concern comes up, stop the doctors and anesthesiologists or anyone else before anything goes wrong. So this system is helping quite a bit. Let me take you to another area where a lot of you have experience. It's medication mistakes. You remember Dennis Quaid? He was an actor, and his wife Kimberly gave birth to two babies. But these babies have to be hospitalized to receive blood thinner called heparin. A nurse came and gave the baby adult dose instead of a baby dose, which is this adult dose is 1,000 times thinner than baby dose. Few hours later, another nurse came, did the same thing, gave her the adult dose. Luckily, Dennis Quaid's wife had a nightmare, and she saw that her babies are being in trouble. She got scared. She went to the hospital at midnight, and she found the babies leaking blood all over under the blankets, and a lot of blood leaking from the belly buttons. If she had not reached there at midnight, babies would have died in 2 or 3 hours. 2 weeks later, a hospital in Texas did the same thing. 16 babies got wrong heparin dose, and 2 babies died. So we have to watch out a lot on medication mistakes also. Infection, you must have heard about quite a bit. Almost everyone I know talks about infection coming back from the hospitals. 700,000 people a year get infection from hospitals, and about 75,000 of them die each year. Now, where are these infections coming from? Many infections come from doctors themselves. They don't sanitize every time they see a patient. And so what happens? They touch this furniture, they touch the call buttons and all those things, they all get infected. And then now question is, how do you stop doctors from not doing that? In fact, if you ask any doctor, he or she would say, I sanitize every time. But surveys showed that about 40% times they don't sanitize each time they see a patient. So question is, what are the hospitals doing about this? Yes, there are some helps there. One is that some hospitals are installing cameras to watch out which doctor is sanitizing and which one is not, and that has helped quite a bit. Another hospital I know, they have assigned a mystery shopper who will watch the caregivers if they are sanitizing or not. And they also found the same thing, 30 to 40% don't sanitize. So the head of the nursing talks to the doctor and whoever is violating the rule right away. So next time they will not do that. And this hospital has got now 100% compliance within 3 months. So there is some progress taking place. Electronic medical records, I'm sure you all have gone through that. These are good things. They capture whole patient history in one place, and they not only capture patient history, they give warnings to doctors who might be prescribing wrong medications based on patient history. So a lot of good things are there, but a lot of bad things are there also. The example of bad things is that sometimes doctors forget to enter the data. So patient history is incomplete, and other doctors make diagnostic mistakes because they don't have complete history. Sometimes the doctors cut and paste some information from one file to another. Computer is not smart enough to figure out what they are trying to say, and so when they put this information in the other files, computer may wind up putting wrong information or no information at all. So these practices are very dangerous. The next area where I'm sure you are familiar with is technology problems, technology mistakes. In one hospital, everybody got 8 times the normal radiation dose for 6 months continuously because the technologist was giving a high level of dose to particular patient, he forgot to turn it down. So, and then another hospital, there was this X-ray system where you press 1 on the keyboard, you get regular chest level radiation. But if you press 2, you get 30 or 40 times more radiation for a particular use. Guess what happened? First week, 10 hospitals killed 10 patients because somebody accidentally pressed 2 instead of 1. And on the keyboard because they're next to each other. We all do that all the times, don't we? I do that all the time. Press a key I don't want to press, I press the next key. So technology hazards are quite a few. In fact, there was one person wearing a pacemaker, went to the department store, and he died in front of the cashier because the cashier's equipment contained a magnetic device which changed the software in the pacemaker, changed the setting of the software. So there are a lot of technology mistakes. I'm sure you're familiar with in emergency department experience also. Have you ever been there? It takes on average 3 hours to wait there. That's average. That means some people wait as much as 6 hours. And during that time, if you have a stroke or a heart attack, you could not be surviving waiting lines. But that's the truth of the emergency departments. In fact, in New York, one woman waited 24 hours before she was called in. During the 24 hours, the blood clot from her leg traveled to the brain, killed her, and it was all captured on video. So make sure the emergency department, if you got real emergency, try to call 911 instead of driving your car there or having a relative drive you there. Another common kind of mistake is experience-related mistake. That means people who are providing the service don't have enough experience. Like, for example, every month of July, new medical graduates join the hospitals, and they don't have any experience practically. They make tons of mistakes. So this is called July effect. So try not to go to the hospitals in the month of July. Other mistake is one hospital had hardly any experience in doing surgeries. They hired the best surgeon in the United States, but still 8 babies died in the 2 years they started their program. The reason for that is the program had only 27 surgeries a year. That's not enough to give them enough whole team experience of preventing accidents. Okay, another last reason I want to cover is reason for overworking. Nurses, 50% of them have back injuries, and many of them work 12 hours a shift. So they cannot really help the patients when they are under pain themselves. Besides, they hear thousands of alarms every day. So they don't know which patient is in crisis, which one is not. So as a result, they don't even reach the patient. A lot of patients have died that way. Okay, so what are hospitals not doing? Well, one thing the hospitals are not doing is not managing very well. They are supposed to use the tools which predict all kinds of harm scenarios and prevent them before they happen. And they hardly use those tools. I told you about the major mistakes, but there are a lot more. Hospitals need to predict these mistakes beforehand and prevent them before any harm is done. And there's a philosopher, Oppenheimer, he said, genius is one who has answers before the questions. And that's what we are talking about, preventing harm before there's any question about harm. And I plan to do more lectures on this subject, but right now I just want to tell you that the life we save could be yours. And I want to thank you for listening. If you want to look up more information on this subject, look up my book, Safer Hospital Care. And my name is Dave Raheja, and good luck to all of you. Thank you.